Hello, friends. So, I wanted to give you some tips on your TMJ or your jaw health and maybe help you loosen up some tension. So, first of all, I want you to open and close your jaw slowly while looking in a mirror. So, I'll show you if you do this slowly. Can you notice the C curve that happens with my opening on this side? You might be able to tell with yourself if you open and close. Sometimes there's something called a C curve, which is just a little bit of a swoop, and sometimes there's an S curve, and sometimes it will go out and then back in. You might be able to notice, you might not. It might be subtle. Anyway, whichever way feels like there's more pull or more tension on your muscles of your jaw, we might be able to help release some of the tension. So first of all, notice how you're sitting. Is your head forward? From your neck, are your shoulders rolled forward as well? The more you sit up straight and have your head right on top of your spine, the less tension you're going to create in your neck and in your jaw. So there are 4 TMJ muscles. The TMJ stands for temporomandibular joint. So you have 4 muscles that contribute to your chewing of your food. One is the masseter muscle, which is down at the lower jaw. You could probably palpate it or touch it, push on it, and see if it's tender. If you notice that the muscle pops out when you clench your teeth, you can probably feel it there. Could be a little tender. And then there are 2 muscles that attach. The majority of the muscle attaches from the sphenoid bone, which is one of the inner cranial bones, and come down right into your jaw. And the 4th muscle is the temporalis muscle. It runs the majority of your head, kind of like a big seashell, and comes down into your TM joint. So those 4 muscles are responsible for opening and closing your mouth, and some of them can get really tight or imbalanced for whatever reason. If you've had lots of dental work, if you have, if you're a clencher or grind your teeth at night, sometimes the way that our postures are can contribute to that tension. So I would love for you to be able to release some of that tension. One other thing you can do is if you open your jaw and then just rest your teeth back into what feels natural. I want you to be able to feel whether you have extra tension in this muscle here or this muscle here. And then try again and open your jaw, and then try to align your teeth, the bottom teeth and the top teeth, from tip to tip, and close it that way, and see if there's any difference in how your jaw feels. Does it feel tighter or does it feel slacker? So try that. So mine has a little bit of a slacker feeling when I try to close my teeth tip to tip. It feels less tight in this masseter muscle. The way that they normally sit, the lower teeth are slightly behind the upper teeth, and that can create some tension here. I often have some tension in there. And tension in the jaw muscles can often cause tension in the neck, cause headaches in any part of the head. So it's really important to be able to slacken them and loosen them up a bit so that it's creating less symptoms for you. So one of the ways that you can treat your jaw muscles yourself is sometimes when when you don't have extreme pain, when you don't have a headache or a migraine or anything like that, you can put a little bit of heat either on your neck muscles or even on your jaw muscles here. It can help blood flow, and it can help relax the muscles a little bit. So then you can also stretch those muscles. Now, one of the ways you can stretch the masseter muscle would be to open your jaw while just putting your knuckles on the side of your face. And as you open your jaw, you push your knuckles inward and draw them down towards your chin. Just try it with me. How does that feel? It's a little bit tender. It's a little bit tender on me. So you can do that by you're stripping the muscle as well as stretching the muscle with your jaw open. Okay, if you want to just stretch your masseter muscle, you can open your jaw and put a little bit of pressure on your chin. And you want to hold that if you can, pain-free, don't cause any extra pain, for about 30 to 60 seconds. And you can repeat that a few times a day if it feels like it's a good stretch. The other thing that you can do is self-massage. So right where that masseter tenses up when you clench your jaw, you can feel it popping out. You can massage both sides at the same time or one side at a time. And just press hard enough and go in circular motions. It's really great so that you're not causing yourself a bad feeling kind of pain, like shooting pain, or it's unbearable or getting worse. You want it to feel like a good kind of therapeutic pain. So you can strip the muscle downward or upward, whatever feels right to you. So that's the masseter. The other muscles up here that we can access are called the pterygoid muscles. And if you find that bone right here going right from your ear all the way forward into your cheeks, and you can just press on the muscle and strip downward from your ear all the way down just underneath the bone. So you're not hurting yourself by stripping on the bone, but you've got the muscle right underneath it. And you can test it the same way as the masseter, putting your fingers just under the bone there and clenching, and you'll feel the muscle pop out into your fingers. So you can strip that a few times, whatever feels good. And then working with the temporalis up here, you don't want to push too hard on the temple area, but just above it, you can do circular motions and strip up towards the side of your forehead and all the way across what's called the parietal bones. Head massage feels so good. That's why why people like going to the hairstylist and getting their hair washed. We're massaging all of these head muscles. So you can go all the way back to just behind your ear. You can even pull on your earlobes if you want to, if it feels good. Just hook your fingers in there and pull backwards. Pull out. You can pull up. That feels really good. And down. You can even push on the little flap in towards your ear, and you can push it out towards your face. That feels really good too. You can even strip up from that jawbone all the way up in front of your ear. And then just stroke down from your head down to your jaw. So that can help decrease some of the tension that you might be feeling. Please feel free to reach out to me and send me a message on Facebook if you have any questions. Thanks so much for watching.